good morning to everyone. Joining me today in studio is Miss Mukwambi, a paramedic student from NAST, and I am your host, Leonard Shipyo. Today's discussion will be based on shock. Shock is defined as a clinical syndrome that occurs due to inadequate tissue perfusion that may result in hypoxia and necrosis. The types of shock that we might encounter while waking may include hypovolemic shock, cardiogenic shock, septic shock, neurogenic shock, and anaphylactic shock. The clinical features that the patient might present when he's in shock may include an increased heart rate. Upon assessing for the vitals, the blood pressure, the practitioner might notice a change in blood pressure that may be due to reduced pulse pressure, an altered mental status. This is because there is not enough oxygen that is going to the brain, and the patient might present with tachypnea, cyanosis, and a cool and clammy skin. So the body's compensatory mechanism that it has towards shock may include an increased heart rate in an effort to increase cardiac output, which is the amount of blood that is being pumped every minute, an increase in frequency and the depth of the respiration, an increase in the release of oxygen, which is oxygen dissociation from hemoglobin, the diversion of blood within the lungs to areas of maximal gas exchange, and a reduced urine output due to the release of aldosterone and the antidiuretic hormone from the pituitary gland. However, I'm going to discuss more on the hypovolemic shock, since it's the most encountered types of shock when waking. Hypovolemic shock occurs due to the loss of circulating volume that may be induced by blood loss, diarrhea, vomiting, or burns. The body has its own physiological response towards hypovolemic shock, which includes the release of antidiuretic hormone or ADH from the pituitary gland and aldosterone from the adrenal glands. So these hormones, they help in maintaining the circulatory blood volume by reducing the urine output and hence increasing the circulatory blood volume. So yes, and the treatment that we have when it comes to us who are in the pre-hospital field, it has to do with the administration of fluids by creating an IV access route and administering with excess supplemental oxygen according to the severity of the shock. Yes, so now I'm going to hand over the floor to Ms. Mukwambi that will discuss more in detail the other types of shock. Thank you.
Thank you, Mr. Shipyo, for the platform. I will begin with septic shock. Septic shock is due to dilation of blood vessels by substances released in overwhelming infection. Causes include bacterial, viral, or fungal infection. The treatment in this situation will be benzylpenicillin should be given intravenously or intramuscularly as soon as the diagnosis is made. All cases of septic shock require oxygen and IV fluids should be started if the transfer is likely to be delayed. Neurogenic shock. Neurogenic shock is due to dilation of blood vessels caused by spinal injury. Management priorities should be directed towards identifying and treating hypovolemia in the shock patient with a spinal injury. Thus, the key to effective management is rapid, safe transfer to definitive care. Anaphylactic shock. Anaphylactic shock is due to dilation of blood vessels as part of a severe allergic reaction. Signs and symptoms of anaphylactic shock are include nasal rash, itchy skin, running eyes and nose, swelling of the face, eyes and lips, and occasionally the tongue, laryngeal edema leading to airway obstruction, bronchial spasm, tachycardia, hypotension, and cardiac arrest. The treatment of anaphylactic shock include opening and clearing the airway. If the airway is obstructed, intubate immediately. If intubation fails, a surgical airway is required. Give 100% oxygen, 15 liters per minute via a BVM mask. Give 0.5 to 1.0 mL of adrenaline. Establish IV access. Give crystalloid rapidly according to the patient's requirements and local protocols. If bronchospasm is present, treat as asthma by giving hydrocortisone 100 to 200 mg via IV or 5 mg salbutamol via an oxygen-driven nebulizer. Cardiogenic shock is due to loss of normal cardiac function. This may be caused by failure of the heart muscle, due to ischemia of the myocardium, myocardial infarction, contusion secondary to trauma, rupture of the heart following ischemia or penetrating trauma, and massive pulmonary embolism. Management of this shock involves compression, oxygen therapy, and symptomatic relief of associated symptoms such as chest pain should be given. To conclude, the most common cause of shock in pre-hospital care is bleeding due to trauma. If bleeding cannot be controlled by compression, immediate transfer to hospital along with supportive therapy is the key to improving the patient's survival. We have come to the end of our discussion. A brief overview of what we discussed involves the definition of shock, different types of shock, causes, and the pre-hospital management of this condition. Thank you for listening.